Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you yet another COVID-19 community briefing on the day before Thanksgiving, 2021. It's been a while since we talked, and I think what I would like to do is maybe just give a brief update in terms of some of the statistics that we're seeing. And definitely to send the message that this thing isn't over, that there's lots of COVID out there. And so we're just going to jump into the numbers and we'll go from there. First of all, the state of Iowa, we have 623 COVID-19 inpatients in hospitals. I'm going to give a breakdown of that in just a little bit. 146 of that 623 are in the ICU. So roughly 25%. Of the 623, 53% of folks 80 and over, so 80 plus, 53% are vaccinated. So there's clearly breakthrough happening. And that was surprising to me to see this particular age group particularly hit. I'm going to give you some more stats, and hopefully these are not too much in the end. I'll try to explain them as we go along. So 80 plus, 47% not vaccinated. 70 to 79, 96 of the 144, or 67%, were not vaccinated. So the vaccine's holding up a little better in that age group. 60 to 69, 81% not vaccinated. So again, that's a little bit more what I would expect to see, but it was that 80 plus group that really kind of surprised me. And then if you go to the next age group down, 50 to 59, 89 of the 107 inpatients, or 83%, were not vaccinated. So clearly, the majority of our hospitalizations are in the non-vaccinated category, but there are significant amounts, particularly in the 80 plus group, that were fully vaccinated. Quite frankly, I'm kind of surprised at that age group there are that many people in Iowa that aren't, particularly because normally they'd be in a nursing home or whatever, but nonetheless, that's the stats that are there. COVID is still very much happening in Orange City. As an example, last Sunday we had 5 positives alone in our emergency room. Sioux County, on a little bigger scale, the 14-day positivity rate is 15.4%. The 7-day is 14.6%, and that's compared to a state level of 10.4%. The rate in Sioux County right now is probably equivalent to about last January of 21. So we were in the thick of it then, and we're kind of back in the thick of it again, relative to positivities. And I'll talk a little bit more about that as we go. There are currently 4 inpatients in Sioux County, COVID inpatients. 3 of them are here. We do have an ample supply of the monoclonal antibodies at this time, which is kind of the go-to therapeutic treatment at this time. Those seem to be holding up fairly well, depending on your definition of ample, but generally speaking, we're able to meet those needs. We certainly encourage testing. If you do have symptoms, please be tested. We want to try to limit the spread as much as we possibly can. And so if you're having testing, make sure, or symptoms, make sure that you either isolate yourself or come and get tested to prove that you are not positive. Because of all of this, the masking policy that we have here at the health system will not likely change for the foreseeable future. So continue to expect full masking when you come in as a patient or when you visit as a family member. And staff will be under the same policy as well. A couple other things, a little bit more random. We're at about 68.9% in the state for fully vaccinated. Again, these are the state's numbers, and about 85.6% of the people currently hospitalized are currently in the ICU, excuse me. Nearly 86% of people in the ICU currently are not vaccinated. We do have 27 nursing homes in the state that are still considered outbreak status. So definitely this virus is still there. One other thing, and then I'll move on from the stats, Region 3, so a little bit closer to home, the 20 counties in Northwest Iowa. There are 70 inpatients in Region 3, 18 in the ICU. Again, I looked at the unvaccinated. The 80 plus group, again, was about 45% of those folks were unvaccinated. So there's 11 inpatients of the 70 were over 80, and only 5 of those were unvaccinated. Again, kind of a surprising number to me that there were that many unvaccinated people, but nonetheless, that's what it is. 70 to 79, there were 17 of the 70 are currently hospitalized. 47% of those people were unvaccinated, so about half. 60 to 69, there's 18 people of the 70. 15 of the 18 were unvaccinated, so 83%. When you look at Region 3 as a whole, 65 of the 70 are over the age of 40. So that's 93% are over the age of 40, which is another indication that this is still predominantly an older person's problem. In other words, the virus is affecting the older population more severely, as that should not be news to anybody at this point. But that is still the case. We're in Region 3, 93% of the population is at least 40 years or over. That's kind of enough, and quite frankly, maybe too much stats to begin with, but want to go into a couple things. First of all, boosters. Boosters are now available to anyone age 18 and over. We do 30 to 40 booster shots a day. The supply or the demand is steady, but not overwhelming by any stretch of the imagination. We do about 30 to 40 a day. And again, a reminder that it is available now to everyone 18 years of old and older. And our position remains at the health system that we support folks getting the vaccine. And we believe it's safe. We believe you should have it. And that's our position, and it remains our position. Pediatric vaccines in that 5+ age category, we do not offer that here at Orange City Area Health System. We do recommend that if that's something that you want, for example, Hy-Vee and Sioux Center has the Pfizer vaccine, which we do not have. You have that. Again, there are situations where you might want to consider that, and there are situations where you may not want to consider that. But because of the uniqueness of children and again, the particular aspect of how it affects older populations, and there's some controversy in this, everybody spreads it, that kind of thing. But we really would ask you to consult with your physician with regard to any questions you might have for your children. One of the things that we are encouraging and would like to certainly reinforce again is keeping your engines tuned. It's likely, very likely, that we will just need to learn to live with this virus for perhaps a long, long time. Our treatments are getting better. The acuity of the disease seems to be less. The number of positives are significant out there, but the number of hospitalizations are not necessarily following suit, which is a good thing. So we really recommend all the things that we talked about before with keeping your engines tuned. Diet, with the exception perhaps of tomorrow. But watch your diet, exercise properly, consider a vitamin regimen. Some people believe in that. Pay attention to the mental side of your equation here too. Live your life. Again, a little personal testimony. I do believe that when I had COVID a year ago, that two things were in play. One, I was in really good shape, which is a side benefit of booking an elk hunt, actually. But I was also on a pretty heavy vitamin regimen. I think whether it was being in shape or vitamins, I do believe that the impact to me was much less than it could have been because of those two factors. Again, that's just me. It's not a recommendation, but certainly the healthier you are, the more able your body is to fight off any kind of virus, let alone the COVID-19 virus. So please keep in mind keeping your engines tuned, keep up those preventative health maintenance kinds of things, colonoscopies, annual physicals, blood sugars, blood pressures, all those kinds of things, because you will be better in the end, regardless, if those things are all in play. One thing that I would like to mention, and this isn't so much COVID, although it is a little bit of a impact of COVID, is our walk-in clinic. Our walk-in clinic is getting saturated, is one word, is very busy. Let's put it that way. Our walk-in clinic is very busy. We ask you to consider in use of the walk-in clinic, whether it is an urgent need or not. There's emergency, which you would go to our emergency room for. There's also urgent, which the walk-in clinic was intended to be after hours. Please continue to use our regular clinic if you can, for those things that maybe has been going on for a couple of days and you just want to get it checked out. And save spots in our walk-in clinic for urgent kinds of things. It's just a little bit of a plea. It's a little bit of an ask. And then also understanding and grace when we try to meet the demand that the walk-in clinic is currently presenting. And it has been significant demand, and we are trying to keep up with that as best we can. I think one of the things that I want to conclude with is simply thankfulness, and to thank all of you for hanging in there with us and listening to these videos, to thank our workforce for those people who are at the tip of the spear in terms of living out this thing. People are wearing thin. There's no question about it. We've been in this, what we used to call a marathon, and are now calling it an ultra marathon, which for you runners out there, instead of 26 miles, it's 100. We're in probably a couple marathons at this point in our way to completing the ultra marathon. So it's there. I'm extremely grateful for our staff. We're doing everything we can to support them. And we greatly appreciate the fact that they are our frontline workers, our frontline defense for not just COVID, but for all the other things. So very grateful and thankful for all of our staff. Just conclude with this little saying that we've been saying all along. Basically, the risk out there is low enough to live your life, but it's high enough to be careful. So as we go about all of our Thanksgiving plans this weekend, enjoy yourself, have a good time with family, moderate maybe what you eat a little bit, take a walk afterwards, get outside. But thank you for listening to this. Thank you for everything that you've done for Orange City Area Health System over the years, and especially over the last 18 to 20 months. Thank you very much, and we appreciate you joining us today. Thank you.